It was August the 15th, a Thursday. I came in because I had a blockage in the duct that went to my pancreas. What I can call my night nurse, Sam, she was very professional. I felt very comfortable.
My rule of thumb with each patient is to envision myself as them. Empathizing with my patients allows me to better care for them.
She was making her rounds, and usually every time she'd come in, I'd tell her a joke or something like that.
We had a lot of fun that night, and he made me laugh. I'd like to think we made each other laugh. And he, of course, wasn't feeling very well, so I did my best to keep the humor alive, and I just remember laughing a whole lot throughout the evening.
Well, this time when she came in and said, you've got a fever, we have to take care of that, because she knew that I had to have an operation on Friday, and if I had a fever, I wouldn't get this operation. So when she came in, she said, well, we have to get this fever down, and the only way we can give that, we have to give you some Tylenol. I said, well, no, I can't take anything by mouth. Well, Sam said, well, there's other ways that we can give you Tylenol. And when she said, roll over on your side, Ed, I knew that something was coming. That's the kind of a reputation we had. We had a laugh between each other.
I think I treat patients like people. I feel like sometimes they're looked at like a number, and I try to walk into every room as if this isn't a great day for them, and I'll do what I can to make them as comfortable as I can. And
so she had given me the suppository, and she said, well, now I have to leave, and I have to go and take care of your neighbors. And this got me thinking like I was part of a community, that the people in this community wanted to take good care of me. When the next morning, I went through the procedures, and when I came back, the gentleman, Tyrone was his name, and he was the custodian. And he came in and said, oh, how are you doing, Ed? And we had a good conversation, and again, we treated ourselves with a couple of jokes, and it was a lot of fun.
Well, entering the room, he gave me a good welcome, and from there, we've been chatting me while working. He was just an awesome little old man. Talked some really good stuff, and I tell him my jokes, he telling me his jokes.
In my recovery, I knew that I would recover real well, and because of all their attention.
I have a treat for you.
Oh, okay. There she is.
how are you?
My jokester.
Yeah, you got that right.
Very good.
Hi.
I know you gave me the joke about why dogs can't operate MRI machines. And you told me that one, right?
Yeah, we did.
That,
yeah.
Cats can.
Right.
Well, I got one for you now.
Okay, I'm ready.
Okay. Why should you never lie to an X-ray technician?
I don't know.
Because they can see right through you.
That they do, yeah.
That's our little corny jokes we were passing back and forth. Every time she'd come into the room, we would just have a lot of fun talking to each other, and you sure give me a lot of confidence. And
You're so welcome. My pleasure.
Yeah.
Yeah. So
Good. Wonderful. I'm sure glad
Lovely
to
to
see
see
you
you.
again.
It makes me feel like I got into the career I wanted to get into for the exact reasons I wanted to get into it. And sometimes working in the medical profession can be thankless, so it's nice to hear that I was appreciated, and it feels really good.
But being a great housekeeper, when you enter a room and the way you approach a patient, and you enter that room with a smile. Because cleaning the hospital is not just part of my job. Part of my job to make a patient smile and be happy inside.
I really feel that this total experience of this coming to the Adventist hospital has really opened my eyes a lot to how a real good hospital can operate.